Mr. Fetchner, you made a statement opening that says when a cardiologist can see a trend analysis for daily vitals of a CHF patient living independently at home, meaningful use will exist. This type of meaningful use does not occur by investing in certified EHRs alone. This occurs when an entire provider network is connected and coordinated around the patient's plan of care. And I understand that. So you're looking at this meaningful use term as a living term that's going to evolve. Is that true?
Yes, that's correct.
Okay.
I think we're going to have a difficult time nailing down one specific meaning, which is why I would completely agree with Dr. Cressley. The broader you make it to be inclusive, I think the more you're going to stimulate adoption.
Well, and I agree with that. I just don't want to. Once we come up with a definition, and I think that this is something that y'all need to put into this time of input, is that this term, as the system progresses, may change. I mean, how it's looked at. So I think that's a linchpin to how successful this is going to be and how many people are going to participate.
Yeah, I think the pace of adoption as it speeds up is going to be incredibly difficult to put definitions around with regards to regulations and things like that. So I think the more we allow the entrepreneur, the individual, the small business line of sight into what the goal of that regulation is,
Absolutely.
And create a generous and efficient waiver process where they can say, hey, I'm meeting this in a different and alternate method, I think that's going to go a long way to promoting the adoption.
And I think that's a good point. And I think Dr. Edwards kind of alluded to that, as the federal government needs to kind of get out of the way. And so, no, I know you didn't say it. But Dr. Edwards, I will ask you one other question about meaningful use. Is it possible for these small group private physicians to meet the HHS health IT implementation goals without meaningful use, without that term?
Boy. Honestly, yes, Mr. Westmoreland, it is possible for small physician practices, large physician practices to adopt and to utilize technology in a meaningful way without the federal government having defined meaningful. I agree with Dr. Cressley. The definition of meaningful needs to be broad enough to incentivize and encourage the adoption and utilization. However, you need to have some guidance in terms of how you would distribute those funds. If I were rule the world, I would ensure that the distribution of those funds met the needs of the small business practice, the small physicians, the entities that have the greatest challenge in adopting due to perhaps their age of their practice, their revenue stream, or their access to technology based on their location being in a rural environment. If we can make sure we drive the limited resources that are available to increase adoption among those who are least likely to adopt, I think we would make the best use of those funds. Meaningful will mean different things to different people. It's not just adopting it and having it sitting on a shelf, it's actually utilizing it for the benefit of the patient. Right. And the consumer.
And let me say, you made a point, I think, when the chair lady asked you about age or specialty or whatever. Every time I go to a doctor, I ask them about the IT and the electronic health records. My wife, and thank the Lord she doesn't have cancer, but she had to go to an oncologist, and I was asking him. And one of the reasons that they had not gone, or at least attempted to, is because the system that they had looked at did not meet their needs for what it took to input the information. I went to my doctor, and I asked him about it too. It just happened to be a urologist, and he made, I don't guess I'm violating any HIPAA laws now, am I, about anything, but he said the same thing. And so I think this is something that we're going to have to get down and take into consideration when we're looking at meaningful use, to make sure that the federal government doesn't have a one-size-fit-all kind of thing, and that they have to look at each of the individual specialties and professions and healthcare providers, whether it be a long-term healthcare or at home or wherever it is, that they look at this and take this under consideration when they're coming up with this term that's going to be so vital to who is able to have accessibility to the funds. But with that, Madam Chairwoman, I'll yield.